Hello, ladies and gentlemen. This is Dr. Alemayehu Bekele from Ethiopia. I'll be talking on implementing the Ethiopian primary healthcare clinical guidelines in Ethiopian settings. To give you background, the Ethiopian primary healthcare clinical guidelines are a contextualized version of the evidence-aligned clinical algorithms for primary healthcare clinicians in low and middle income countries. It was developed as part of the practical approach to care kits and contextualized to the national situation. It's also believed to increase access to care for people with conditions like non-communicable disease and mental health problems. It's also in line with the national strategy supporting task sharing in healthcare. And with its implementation, there is a potential to achieve better, more integrated care closer to home. And training and implementation of the guidelines was cascaded to the primary healthcare facilities in Ethiopian context. But as for what has been achieved, is not clear so far. So we have come up with research questions like, what is the perception of the primary healthcare clinical guidelines, training and implementation? And after the primary healthcare clinical guidelines are implemented, what are the ongoing bottlenecks to quality person-centered care in NCDs and the mental health problems? The methods we have employed is in-depth interviews were carried out with 10 primary healthcare clinicians and 1 regional primary healthcare guidelines focal person, and review meeting of stakeholders was also used as source of data. Thematic analysis was employed. Contextual determinants were then mapped to the consolidated framework for implementation science, and determinants of behaviors were mapped to the theoretical domains framework. Potential implementation strategies were identified using the ERIC tool. Coming to key findings, the main contextual barriers associated with the implementation of the Ethiopian primary healthcare clinical guidelines were like the availability of resources, including critical shortage of diagnostic tests and medications, which have ultimately undermined efforts to follow the primary healthcare clinical guideline. And there were also significant barriers associated with the ability to address patient needs and the resources. And there were also several determinants of behaviors that influenced the ability to effectively implement the guideline. For instance, patients and the wider community had low awareness about the non-communicable disease and the mental health conditions, which resulted in patients presenting very late to the healthcare settings, and presenting with severe illnesses. In conclusion, primary health care clinical guideline implementation on expanding access to task shared care for NCDs and mental health care has been constrained by various challenges, and health system bottlenecks need to be addressed to fully implement the guideline to transform the quality of primary health care through having robust institutional policies, resource provision, supportive supervision, and continuous capacity development and mentoring. I thank you. If you have comments or questions, you are most welcome.